Aloha kako. My name's Brianna Gouveia, Program Specialist at the King Kamehameha V Judiciary History Center. On behalf of the Hawaii State Judiciary, mahalo for joining our live program. I hope everyone is well and taking care as we enter our 5th week of the state's stay-at-home order. Updating us tonight on the steps needed for our community and economy to emerge from the COVID-19 pandemic are Sumner LaCroix and Tim Brown. Sumner LaCroix is Professor Emeritus of the University of Hawaii at Mānoa's Economics Department and a Research Fellow at the University of Hawaii Economic Research Organization. Tim Brown is a Senior Fellow at the East-West Center. Before we begin, I want to remind our live audience that you can send in questions through the Q&A box in this webinar at any time during the program, and I'll read them aloud after the presentations. I'm sure we'll have many questions, so without further ado, Tim?
Thank you, Brianna. This evening, Sumner LaCroix and I are going to talk about the issue of controlling the coronavirus epidemic and trying to bring back Hawaii's economy. Everyone knows we're shut down. In fact, many of us are chafing at the bit, basically get out of our apartments, get back to work. But we have to proceed carefully on that. So the real question is, how do we open again? In a brief that Sumner and I prepared almost 2 weeks ago now, we had a 4-step plan. First was to stem the flux of new infections. This has already been very effectively done with the travel ban that the governor instituted in late March. The second step is to slow the spread in the local population. This has been done through stay-at-home orders, social distancing, and the use of masks, which have now been mandated across the islands. And they're having a significant impact on the epidemic. Third, we need to establish a solid system for testing, tracing, and isolating those who are infected with the coronavirus. And then finally, we need to monitor carefully and then gradually relax the restrictions we face when conditions allow. Now, I don't want to underestimate the urgency of this. As this headline from the Star Advertiser on Friday showed, 37% of Hawaii's labor force has now filed unemployment claims. Tourism has been shut down, with the small exception of a trickle of tourists who continue to come even though they've been asked not to. More than 100 hotels have closed. Non-essential businesses are all closed. The restaurant sector has basically been reduced to takeout and delivery, with a large number of restaurants just outright closing. And there's a state budget shortfall that's been estimated at $1.5 billion over the next 15 months. But even though we're all feeling the pain, we have to be very careful when we reopen, because we have to remember that COVID-19 is extremely contagious. This slide shows an example of some of the clusters that have occurred in Singapore, where they've been doing a very, very good job of doing contact tracing and looking at where the outbreaks are occurring. For example, there was one cluster around a private dinner function that was 47 people. There was another cluster of 8 people around a trendy burger restaurant. And there are several clusters around churches and family gatherings. And Singapore is not alone in this. We've had 2 major clusters in the last week announced here in Hawaii. The first at the McDonald's on the Big Island, which involved 18 workers and 12 family members. The second at Maui Memorial, which involved 29 staff and 16 patients so far, and these may continue to grow. We don't have full information on the clusters here, but there are at least 6 clusters and various families that have been investigated throughout the islands. So we're going to have to proceed very cautiously. The potential for resurgence in this epidemic is extremely high. Now, with that said, Hawaii has actually done a good job so far. The current situation has kept a low cumulative number of infections, only 584 through noon of today. Low hospitalizations, only 55 people, and only 10 people have died of COVID here in the islands. Now, there's a group called COVID Act Now, which has been doing modeling basically for places like Hawaii. And you can see here, this is their current projection. The purple bar or area that you see here is their current projection based on current trends. And they're saying that our hospitalizations will probably peak somewhere around 60 hospitalizations over the next week or two. Okay. But we have to be very careful, because if we return to our previous habits, they've also run a projection where if we go back to the way we were before the lockdown, hospital capacity will be overwhelmed here within 3 weeks. And you can see the scale of this graph has changed from 70 hospitalizations to now 16,000 hospitalizations. And our peak would be about 13,000 hospitalizations if we go back to what we were doing before. So we have to be extremely cautious with a virus which is as easily transmitted as this one. So for now, we've got it under control. What do we do next? Now, I'm going to focus on the preconditions for us to reopen. Sumner will then talk about the way that we might actually start to reopen the economy here in Hawaii. The preconditions I'm going to discuss are, first, the following systems must be in place and functioning well: testing, contact tracing, and isolation and quarantine of those found positive. The public must be on board with sustaining prevention. We're not going back to normal anytime in the near future. This virus will probably be with us for at least a year, maybe even 2 to 3 years. We will have to see steadily declining cases that indicates that we continue to have this thing under control. And we must be well within our hospital capacity. If we were close to the hospital capacity and this virus were to start spreading again, we would very quickly overwhelm our health system in the ways that cities like New York and large parts of Italy have seen. But we don't want to just flatten the curve here. We want to squash the curve. So what do we need if we're going to do that? Well, let's discuss those preconditions. First, what do we need in a testing system? What the testing system does in this situation is it monitors the virus in the communities, and it helps us to raise the alert. It has to inform actions on the timescales of the COVID-19 virus. This means days. It can't give us information about what was happening 3 or 4 weeks ago. It has to give us information about what was happening just a handful of days ago. Every delay we have in getting results, tracing, and isolating contacts means we'll have many more new infections to deal with. And the outbreaks on Maui and the Big Island show us how rapidly these clusters can grow here in the islands. So what does this mean that we need in a testing system? First, we need a clearly defined and coordinated strategy for testing agreed upon by all parties. Right now, we have a testing system that has several different pieces which are not properly coordinated and which do not constitute a comprehensive strategy for identifying the maximum number of cases that we can with the test we have available. We need rapid turnaround on results. We can no longer wait for results to come from 4 days up to 2 weeks when they're coming from mainland labs. Testing needs to be done locally, ideally at the point of contact. We need enough testing capacity to support multiple needs for testing. This includes diagnosis, means testing of healthcare workers and other frontline workers who deal with a lot of customers, the testing of close contacts during contact tracing, and also for surveillance in the community so that we have a clearer picture of what's going on with this virus across Hawaii. And we will need to define some front-facing metrics that allow us to tell how these systems are performing. For example, the time from sample collection to test result, the percent of tests done locally, percent of symptomatics tested. Once we get the test, how do we build stronger contact tracing? Contact tracing is essential because this is what actually stops the transmission and arrests the spread within the community. The features we need in this system are, first, rapid interviews after a positive test. We cannot afford to be hearing, oh, it'll be 3 to 4 days before we finish the interviews. The interviews need to be done preferably within 24 hours. We need adequate staffing to do contact tracing so that we can reach all contacts urgently. And Bruce Anderson has mentioned anywhere from 20 to 40 close contacts are common for people. We need to monitor isolation and quarantine, and also the self-monitoring of people for symptoms, much better than we're doing now. And we need to be able to surge contact tracing capacity if necessary, if we start to see another outbreak. We need transparency and openness with the public. The case reports and descriptions of clusters are what help the public be aware of what's going on within the islands and who's at risk. Cluster information tells them where the risk is actually occurring within the community. And again, we need front-facing metrics here. What's the time from getting a test result to conducting the interview? What's the average number of close contacts? What percent of close contacts have been reached? What percent of close contacts are monitored to the completion of quarantine? These are essential metrics that will help us to evaluate how well the contact tracing system is working. And I'd be remiss if I didn't mention that electronic technology can help a great deal in terms of doing this. Now, what prevention must be in place to reopen? Prevention is essential because that's what builds the resistance in the community to the spread of COVID. Several essential elements are needed here. First, we need the isolation and quarantine monitored, and we need facilities available for those needing them. We know that this has not been adequate in recent weeks, and that desperately needs to be improved before we can reopen. The public needs to buy into the need for sustained prevention. This virus is going to be with us for a year or two at least, so we need to recognize the continued need for social distancing. We need to agree to use masks in public spaces. Everybody needs to understand the steps necessary to protect our kapuna and also our vulnerable family and friends. And we need to recognize that a resurgence may require another lockdown. And finally, we need adequate personal protective equipment for all healthcare workers, first responders, frontline staff in stores, and ideally, ultimately, for the public as well. Finally, before we move to reopen, we need first testing, tracing, and isolating all contacts working very well. We should be seeing steadily declining trends in infections. Most are now saying a 14-day decline might be a signal for possibly opening if the other systems are in place. And we must be well within our hospital capacity. Otherwise, a viral resurgence could overwhelm our system, and then not only people with COVID would be dying, but people with other conditions would die as well. As of today, we've done a fairly good job. You can see there is an apparent decline in cases here in Hawaii. It jumps around, as it will always, where we have relatively low numbers as we do in Hawaii. But nonetheless, we are seeing positive results so far. So some have questioned whether we're ready to reopen yet. I think we could discuss that more when we get to the Q&A session. But once we have satisfied these preconditions, then how are we going to restart the economy? And for that, I'll turn it over to Sumner LaCroix. Sumner?
Share screen. And let's see here. Aloha. I want to thank everybody who is attending tonight's webinar, as well as the organizers of this. We're really honored to be the guests of the King Kamehameha V Judiciary History Center and to be able to give this presentation. I am going to focus on the Hawaii economy, where are we at now, and how can we get back to a healthy economy. Right now, the Hawaii economy is deep into depression. We've had a total shutdown of the tourism sector. The tourism sector accounts for 23% of our GDP. 249,000 tourists a day typically came here. 249,000 tourists a day were typically in Hawaii on any given day. Over 30,000 a day arrived here. We're now down to a little over 100 tourists arriving per day. So this is a dramatic decline that's essentially shut down the sector. Compare this back to 2009, when we had a fall in tourism arrivals. 2009, real GDP fell about 2.25%. Now compare this to the fact that our entire tourism sector is shut down. It's probably fallen by about 23%. That's a dramatic difference. The problems that we face today are dramatically larger than the problems that we faced just 11 years ago during the Great Recession. It's useful to note that 80 to 90% of the collapse in tourism happened prior to the 14-day quarantine being imposed. Actually, people felt nervous about traveling. They were afraid of catching the virus on their travels. Most people canceled reservations on their own. We were down to about 3,000 tourists a day coming to Hawaii when we imposed the quarantine. Unemployment at 37%. Well, we lead the United States in this degree of unemployment. It's very possible that unemployment rates might increase. We figured that about half of the 37% is due to the tourism shutdown. And the other half is due to the stay-at-home order. The stay-at-home order is affecting sectors that serve Hawaii's resident populations, affecting things like shops, restaurants, and professional services. I want to note that this crisis is really different from earlier economic crises, as the state government in this case has taken deliberate measures to put the economy to sleep in order to restore the health of the population. The idea here is that to restore the health of the population, we need to stop interacting as we did before. And that at some point, when the health of the population is sufficiently restored, we can essentially bring the economy out of the deep sleep that we put it into. Our main short-term problem is providing relief to people without jobs, to people with reduced hours, to people who are without sufficient income really to meet their basic needs. That's our short-term problem. It's not stimulus. It's not stimulus because we've actually intentionally put the economy to sleep. We're not really interested in it reviving right now. But our main long-term problem, once we restore the health of the population, is to provide stimulus. We're also going to need some regulatory reorganization. We're going to have to rethink our regulatory regimes for numerous industries. Federal and state governments. So how are they dividing the tasks of controlling the epidemic and providing relief? We've written two briefs, Tim Brown and I, and we noted in the first brief that essentially there's been a division of labor between the federal government and the state government. The federal government essentially is tasked with providing relief, and later on it'll be tasked with providing stimulus. The reason why the federal government is most adept at doing this is it, unlike the state, has the ability to borrow trillions of dollars in financial markets and to print money if it needs to. There's been an initial $2 trillion for individual payments, expanded unemployment insurance, aid to businesses, and Federal Reserve facilities for purchasing short-term state bonds. So the feds have, in many ways, gone all in on trying to provide relief to individuals, businesses, and states. There's still more to come. We're going to need a lot more relief than what's been provided in the current packages. The state government essentially has been tasked with the responsibility of managing the epidemic within the state. For Hawaii, this involves deciding how rigorously to enforce stay-at-home orders, closures of non-essential businesses, and social distancing orders, and then when to relax these orders. And although that division of labor was a little bit stressed this week by President Trump, who at one point said, no, I'm in charge of everything, and then later said, no, the states are in charge, do your own thing. It's pretty much acknowledged that the state governments in many ways have the best idea of what's actually happening inside a state. And that if they make good use of the particular knowledge of circumstances in place, that they should be able to make the best decisions. There's contested ground over other things like the production and distribution of testing resources, of PPE and medical equipment, and of expanding medical facilities. The states want the feds to take leadership in this area. And the feds have basically said, no, we want the states to do a lot of work in this area. We'll do something, we're not quite sure what. So I call this contested ground because basically the two sides, the state governments and the federal governments, are fighting over really who's responsible here. For many of these things, I think it's absolutely necessary for the federal government to take the lead. For things like purchasing medical equipment, we don't want the states competing with each other and pushing up the prices of medical equipment. The state has put together a team which has been tasked with developing a plan to reopen the Hawaii economy. Alan Oshima, who is a consultant and longtime executive at Hawaiian Electric Industries, and Dr. Mark Mugashi'i, who is the president of HMSA, they're essentially leading the efforts to develop a plan for the state of Hawaii to come up with its responses on both the public health side and on the economic side to the coronavirus epidemic. Now, Oshima envisions a plan with three phases: stabilization, recovery, and resilience, with resilience being a more long-term recovery plan. So for details, you can go actually look at the presentation that he gave today to the House Special Committee on COVID-19. I would note that in this three phases here, stabilization, recovery, and resilience, Tim's presentation focused on stabilization. How essentially do we get the public health indicators in the right position that we can think about opening the economy? So my presentation is going to focus on the recovery aspects. Now, I think there's some really general principles for reopening the state economy. One principle here is that opening the tourism economy is just likely to take longer than the non-tourism economy. And so in some ways, we need to focus now on reopening the non-tourist economy, because that could happen sometime this spring. That doesn't mean, however, that we need to ignore the tourism economy. The planning for tourism reopening needs to occur ASAP. It needs to be on a dual track, even though it's going to happen later, because there's some relatively complex things that need to happen. I'll go over opening the tourist economy in the latter part of this presentation. I think another central principle for reopening the state economy is that once we start interacting with each other more, we should think about moving to better versions of masks. And surgical masks just generally are much more effective than fabric masks. That's not to downplay fabric masks. They're somewhat effective, but once surgical masks become widely available, there's much to be said for the society to make a commitment that when we're in public spaces, we will be wearing surgical masks, because this will again help to reduce transmission. And this is something we need to think about, because once we open up the economy, people will have more contacts with each other, and the more contacts, the more the possibilities of transmission. I think the reopening needs to be gradual, well monitored, and coordinated. It's not worth opening up one sector when it requires another sector to be opened. We need to remember that this is a process that we really haven't done on a large scale in Hawaii before. It's a process of trial and error. And if what we find is that we open up and there's a major outbreak of the virus and we're worried about whether we can control it, we may need to pull back and to reimpose say, the stay-at-home order until it can be controlled. So this is just something I think that we just have to remember, that that the reopening is not for all time, that we just need to see what the results are of the reopening. We also need to remember too here in Hawaii that we can learn from first movers. And first movers are countries and states that are opening before us. These include countries and states that are opening up businesses and sporting activities before Hawaii, as well as schools. If we see what other countries are doing with their school openings, we can learn from them and not repeat the same mistakes when we decide to open our own schools. During the first phases of reopening the state economy, I think every recommendation I've seen, every plan urges vulnerable populations to stay home even after we open up, or to reduce, if they do go out, to reduce their interactions with the general population. Now, this is important, and it's important as far as the response from reopening, because this could dampen the economic response from reopening the economy. People over 65, people with vulnerable immune systems decide that they're going to mostly stay home and continue kind of in a lockdown phase, we're not likely to see quite the increase in demand that we otherwise would see. That's just something that we really have to remember. There may be other people in the society who feel vulnerable or just cautious, and they may also stay home more. The first sectors we might open up, these are sectors where social distancing is relatively easily maintained if customers and businesses take the time to take some simple precautions and to reorganize how they go about doing their activities. Now, there's some places that are already starting to reopen. Germany, which has had a major epidemic, today is reopening numerous small businesses. These include small retail stores, bookstores, bike shops, car dealers, furniture stores. Larger businesses and manufacturers are not open. They've complained about this. And the government has said, well, if we're successful with the small stores, the larger stores may come next. I think the government's worried about social distancing within the larger stores. Texas reopened non-essential businesses for which product orders can be picked up, for which product orders can be made online and picked up from the store or curbside. Florida allows golfing, albeit with numerous restrictions put in place to enforce social distancing. So I think some of the businesses we've talked about are ones that can achieve social distancing if the number of customers in the store are limited, the spacing is emphasized inside the business, and mask wearing requirements are enforced. Malls that contain stores that reopen may want to think about limiting the number of parking spaces available. Not something that we typically would do. I mean, usually malls are interested in trying to expand parking spaces to serve more customers. In this case, it's really critical that there not be crowds within a mall so that distancing of the 6 feet is impaired. So the key to reopening many sectors is reorganizing business operations to meet the demand for safety by both employees and customers. And what we're going to find is that the capability for businesses to reorganize to accommodate demands for safety is going to vary a lot. Some businesses are going to radically reorganize their entire operations and will emerge offering a product which can be consumed in relative safety. Others are going to really find it difficult to make changes. And others may find such changes untenable and will close their doors. We do have to remember that in the new environment, not all businesses are likely to emerge intact. Businesses with crowds of customers face special problems. And I think all the examples I gave here are more food for thought rather than recommendations. So things like movies, the new large chair theaters, say at Consolidated Theaters at Ward. It's possible that opening up a theater there might be possible if you have separated seating between small groups. You leave seats between small groups, careful exiting protocols, seats sold online so there's no real queuing to get tickets, temperature checks of people coming in the theater, perhaps also employees who deal with customers, masks being worn inside the theater. Maybe that will happen. Diamond Head Theater with space seating, the audience wearing masks, still a problem of close interaction by cast members. Operation with social distancing might not cover costs. And I put that up as an example of an operation that might not cover its costs. Churches might reopen with social distancing and all of the congregation wearing face masks. Surely no choirs. We've already had big outbreaks come about because of choir singing practices. These would have to be relatively quiet church meetings. There's a critical question too, whether these businesses with crowds of customers, usually for them to open, they have to reduce the number of customers that they're serving. The number of customers in the theater, the number of customers in the football stadium, the number of customers at, say, Diamond Head Theater or in a church. And there's a real question of, can they recoup their variable costs with fewer customers? Let's see here. Businesses involving close personal contact. I think the thing about businesses involving close personal contact is that there's quite a few businesses, there's quite a few employees of these businesses in Hawaii. UHERO estimates 55,000 people have jobs that involve close personal contact out of a workforce of 660,000. These are jobs like hairstylists, massage therapy, dentistry, optometry services, health services, and other places where customers are repeatedly using the same equipment, such as gyms. And whether these businesses are going to be able to restart successfully before a vaccine becomes available, I think it's a question for each and every one of the separate businesses, and it's likely to depend on the particular circumstances of each business and the clientele. There's a big role here, I think, for industry associations to work to try to develop new best practices of operation. It's really too much, I think, in many ways, to ask individual shops, individual people doing these particular lines of business to develop their own standards of operation. This is really where there's a role for industry associations to be very proactive. If the local industry association is not very strong, there's also the possibility of national industry associations doing this. Let's see. Use of people with positive antibody tests. Well, there's some businesses where there's employees who constantly come in contact with customers. If positive antibody tests become common in Hawaii, and if an antibody test becomes common in Hawaii, if you've tested positive to an antibody test, that means that you've already gotten the disease. And the best of circumstances, you'd be immune to getting the disease, at least for a period of time. Now, those employees with positive antibody tests could essentially take jobs that require close contact with other workers or customers, and this would help prevent the further transmission of the disease. Challenges? Well, the strength and duration of immunity protection are currently unknown. Antibody tests are currently unavailable in Hawaii, and serious questions exist regarding the accuracy of those being sold elsewhere. All this would have to be resolved before we would be able to think about using people with positive antibody tests in frontline roles where they're interacting with many other people. Now, reopening the schools, I'm going to skip over. I have 3 slides on opening the schools. I'm going to skip over. I just want to note that Denmark has just last week, opened up its schools only for K-5 students. Germany is opening up its schools in a few weeks for older students. Very severe protocols in the Danish schools. They've gone to great lengths to try to make sure that health standards are imposed. In Hawaii, we know there's not going to be any regular public school sessions until the fall. And the same thing with the University of Hawaii. In some sense, we're somewhat delayed in opening up our schools. We're not that different from other states, but there's some real advantages in being second. And the real advantage is we can monitor what happens in Denmark, Germany, and other places that have early reopenings. Opening up a school system is extremely complex. There's all sorts of issues of transmission of the virus from a student who catches it at school back to an extended family in Hawaii. We need to look really carefully at this. I ended these 3 slides by saying maybe the DOE should send an observer to Denmark and Germany. Of course, that could be done virtually. They could just check in with their German and Danish counterparts via Zoom. Reopening the tourist economy. So I just want to end here on reopening the tourist economy. You know, if we don't reopen the tourist economy over the course of the next, say, 6 to 8 months, we're going to look up and still find the Hawaii economy in depression. It's 23% of the Hawaii economy. And a 23% decline in GDP, any economist would tell you that's a depression era. So it's critical that we work on this. And yet, 2 necessary conditions need to be satisfied. One is tourists need to conclude it's safe to visit Hawaii. Residents need to conclude that tourists will not be contributing to Hawaii's epidemic. Now, if we actually get our act together and we put all of the conditions that Tim talked about in place, you know, we establish a good system of testing, contact tracing, and isolation of people who've been in contact with other people. If we actually do this, and our case numbers continue to be low, people may start to perceive, outsiders may start to perceive Hawaii as a safe place to visit. That could happen sometime this spring. But step 2 is harder because we really need to have residents need to be able to conclude that tourists will not be contributing to Hawaii's epidemic. And this, I don't think, is going to happen until either an effective treatment emerges, residents are vaccinated, or tourists are tested prior to arrival. It's difficult to see option 3, surely the fastest option here, being implemented until late this summer or fall. But then again, testing of potential tourists is possible. Potential tourists can take a rapid same-day antigen test or antibody test before they leave for Hawaii. Tests can be conducted at their doctor's office, urgent care facility, home airport, or other approved testing center. Results could be sent to a cloud data service accessible by airlines and Hawaii public health officials. Information on these tests could essentially by law disappear after a few weeks. If you have a negative antigen test or a positive antibody test, the state could waive the 14-day quarantine. We would essentially view you as a safe person to visit Hawaii. You would not be contributing to the epidemic. But there's severe logistics here. The severe logistics are things like, well, 10 million tourists came to Hawaii in 2019. You know, if tourists need a test before their flight to Hawaii and maybe before their flight back home, that's 20 million tests. To date, we've only given 3.7 million tests in total in the United States. So testing would have to become much more widely available for this type of option to be put in place. I'm somewhat optimistic that this kind of option might be put into place. There's strong incentives for airlines, major hotels, testing facilities to put a feasible plan together. Airlines and other tourism businesses would have incentives to keep the cost down, as high-cost tests only would depress the demand for airline and hotel services. This is a place where the private sector could take the initiative, and the government could essentially certify the arrangements as the key, as the key to its waiving the 14-day quarantine at arrival. There's some barriers. They could include trying to get this plan by the Department of Transportation, the TSA, and the Federal Aviation Administration. I just added this last slide here. This is from Alan Oshima's presentation at today's House Select Committee on COVID-19. And it just puts up, it just is a slide talking about how our, how essentially our habits and behaviors may well change in the long run. These are not necessarily what I would have put in the slides, but I thought it was kind of interesting to take a look at what Alan put here. Conclusion. So, you know, in the absence of a vaccine or treatment, Hawaii's economy faces an extremely difficult situation. The recovery is likely to be slow and prolonged. At the end of the day, the demand for additional safety measures by workers and customers will be a drag on Hawaii's economy that could persist for several years. In the longer run, the changed circumstances of everybody, firms, customers, and businesses will encourage waves of innovation that will place this economy and society on paths that really are unknowable today. All that we know is that our ways of interacting with each other and doing business with each other will be much changed over the next decade. Thank you very much.
Okay, so let's see, do we have any questions? Let's see here.
Thank you, Tim. Thank you, Sumner. I have our first question As we're approaching the 14th day of declining cases, when do you think we can loosen the stay-at-home order?
Okay, let me field that one. I think we may be reaching the end of a 14-day period of declines. But again, you have to remember the number of cases here is still fluctuating day by day. So we do have to be careful. And we clearly need to look at this on an island by island basis. I think the decline on Oahu is much clearer than the decline in places like Maui. And the Big Island has certainly had a major outbreak just within the last week. So I think that, you know, it's not clear to me we're meeting the conditions yet, certainly not across the state. I think the other thing to keep in mind is that I'm less worried about that than I am about whether we have the capacity basically for testing as much as we need to and for contact tracing. Because if the epidemic starts to spread again, we need to be able to surge contact tracing fast enough that we can contain the outbreak.
Mm-hmm.
And that, I think, is the current gating factor that we're looking at in terms of being able to open up again.
Mm-hmm. So what contact tracing is currently being done, and how quickly after notification to the Department of Health are contacts of people infected getting testing?
It is being done, but even Bruce Anderson has admitted that they need more contact tracers, that they don't have capacity currently. We were talking about 3 to 4 days to conduct interviews after the Maui Memorial outbreak, and that is definitely too long because, as I mentioned in my presentation, every day that we delay in terms of tracking down cases is another day for the virus to spread within the community.
Mm-hmm.
So I think we clearly need to improve that system before we're ready to open.
Yeah. Another question related, is it better to test close contacts ASAP or to wait 2 weeks first?
I think you want to test close contacts as soon as you find them, and certainly that's what places like Singapore, Hong Kong have tended to do, South Korea, places that have actually had a good bit of success despite setbacks with the return of people from overseas.
Mm-hmm.
But regardless of what the test result is, those close contacts still need to be isolated for 14 days because the tests are not perfect. They do not pick up all infections. And so people still need to wait out the 14-day self-isolation period before they should be going back out in public.
Mm-hmm. How do you propose the state should handle the influx of tourists that will come when we loosen travel restrictions and the strain that this will put on our hospital system if there's a resurgence?
You want to take that one, Sumner?
Yeah, I'll take that one. Well, I think that what we are hoping is that the tourists who come here will be relatively healthy, that they'll have the negative antigen test or a positive antibody test.
Mm-hmm.
And that the chance that tourists will be importing infection will be relatively low. There is always the possibility for there being an outbreak. The tests are not perfect. Things can go wrong. If all of a sudden we had a major outbreak that was focused on the tourism industry, it's very possible that we'd want to revoke authorization for waiving the travel ban for people who come here for a period of time until we felt that we had it under control. It is a good question whether or not we're going to be able to handle the 10 million tourists that we had just last year. The 10 million tourists in many cases may just be too much crowding. We may have to adjust our sites to a smaller number of tourists. That's also really hard to say. It's possible that if Hawaii is looked at as a safe place to vacation, that there'll be great demand for people to come to Hawaii. That just the idea that we've got our epidemic under control, and that other tourists will be coming here with a negative antigen test result or a positive antibody result. That's something that may yet attract an awful lot of people. We could find the tourism industry roaring back, or we could find that places like California, that's over 40% of our tourists. Places like California, we could find that people are worried about losing their jobs. Some cautious people are thinking maybe I should vacation after a vaccine is developed. Some people may find their stock market portfolios have been battered. This isn't just the right time to take a vacation. So, I mean, that's another possibility here. As far as when enough tests become available too, to be able to use essentially 5 to 10 million tests in the leisure travel market, well, that's only going to happen when there's enough tests for people who are frontline healthcare providers, for people who have symptoms. you can go down a list of priorities that really has to stand above people in the leisure travel industry. Still, if I had to look ahead 4 months, I would say that many of the problems, if not necessarily all, but that many of the problems with the tests will be resolved, and we will be seeing a much larger supply of tests. That crystal ball is one that may or may not work, because also other parts of the world are going to be demanding these tests, not just the U.S.
Mm-hmm. Do you have any idea how much a test like that might cost for travelers, specifically going back and forth when you were speaking about implementing at airports and hotels and stuff?
That's a really good question. And I mean, I think, again, if we're talking about an extremely costly test, no, that's not going to work. But if we're talking about a test that can cost out at, say, $50 to $75, that could work quite well.
Mm-hmm.
It's even possible that airlines and hotels might decide to pick it up for the tourists. It would be partly included in the price and partly picked up by the airlines and hotels. The airlines and hotels have tremendous incentives to try to get a package like this in place, because otherwise their business just isn't going to resume. I don't see tourism here resuming without some type of regime for testing incoming visitors, or a better treatment, or an effective treatment, or a vaccine.
Do you think another island, say Kauai, could open while others remain closed?
Tim, do you want to take that, or?
I think it's challenging, just in that there would still be inter-island travel, presumably, and that's under lockdown right now as well. I think having tourists go directly there potentially exposes that island to the same issues they'd be facing if they were coming through Honolulu initially. So I think that, just opening part of the state, I think, would be rather challenging at this point. I think more likely we need to wait to see what the testing situation looks like and the acceptability of testing to potential tourists before we make any decisions on this, because I think that's the real factor that affects it here. And a lot of people have put a lot of hope on antibody tests, but frankly, right now, antibody tests are probably still a long ways off. And also the proportion of population which has been affected by COVID-19 is comparatively low. So it's not clear that antibody tests are going to help that much in terms of identifying. It's probably more the antigen tests, the current tests for current infections, that are actually much more critical for tourists coming here.
But with respect to the non-tourism economy, I could easily see certain islands opening before other islands open. So I could see, for example, if conditions were satisfied, if the 4 conditions we talked about were satisfied on Kauai before they were on all the other islands, I could see Kauai opening up first. Hawaii's done a pretty good job in controlling its epidemic. Maybe that will actually happen.
With tourism having such a hold on our economy, do you think this should be a time that we put funding into diversifying it beyond just tourism into areas more sustainable?
That's an old question, and it's a hard one. It's a hard one just to come up with brand new industries that are going to be profitable out here. There's lots of challenges to locating certain businesses. In Hawaii, we went through a period back in the 2000s where we gave large subsidies to high-tech businesses. It was a poorly designed program, but many of the businesses that started up eventually left as they matured. We didn't necessarily get a lot out of our investment for that. But I absolutely think that this is the time for us to take a close look at what we want out of a future economy, and even what we want out of the tourism economy. I mean, it's useful for us to look and ask, do we want to see our natural resources degraded as they've been as much in the past by overuse by large numbers of tourists? This may be the time to think about how do we restructure, say, tourism at Diamond Head so that we're not finding tourists packed in wall to wall going up to the Diamond Head view. Yes, it is time for us to consider those things, but I don't think that's something we can start right now, but that's not the immediate emphasis. The immediate emphasis here really needs to be opening up the economy in stages. But there's no reason why we can't be talking about this and looking at what the future is going to be like now.
Going back to contact tracing, can the state implement a contact tracing app? How much workforce does the state need to implement one? And could the state minimize the cost by hiring state workers that are underemployed?
I think this is something that is obviously being examined at the state level right now. I think Department of Health has admitted that they don't have enough contact tracers at this point and that they need to expand their capacity, probably somewhat significantly. Certainly it seems that some workers might be retasked with appropriate training. But again, I think we need to make sure as we start to reopen that that capacity remains with the ability also to surge when necessary. So that if we do get another outbreak like Maui Memorial, basically we can reach people within 24 hours and get them into isolation as quickly as possible so that we don't allow that to spread any further. I think currently we're seeing much longer timeframes than that. And so I think that's an indication that we don't have the capacity to deal with that right now. Yes, I believe we can come up with the capacity, but it will probably require some additional workers being located at Department of Health, some additional budget for the Department of Health to deal with that. And I think that needs to be seen in light of the total cost of keeping the economy shut down. It's a drop in the bucket relative to the cost of having our economy shut down for a longer period of time.
Does it sound feasible to have the state use volunteers for contact tracing through organizations like the Red Cross?
In the short term, that's one way to possibly raise capacity, but it's not a sustainable solution, and nor is people working 24/7 a sustainable solution. We have to have adequate contact tracers that people can work reasonable hours and still reach everybody they need to reach. We cannot afford to have the contact tracers getting burned out, because that will make it much more difficult for them to do their job, and we will lose control of the epidemic if it starts to take off again.
How do you think we can make surgical masks more available and economic opportunity to repurpose some businesses?
So if you go back to before this crisis, go back to like January, you could walk into a drugstore and buy a package of surgical masks for relatively cheap. They were not very expensive. And then all of a sudden, as the epidemic hit Europe, Asia, and the United States, surgical masks kind of flew off the shelves, and there's been a shortage of them. But this is the type of product that the free market system is relatively adept at producing. It's a simple product to make. It's known what the quality standards are. The ingredients are relatively straightforward. They're mostly made out of cotton. This is a market where I would expect to see within the next couple of months be amply supplied with surgical masks. So it's hard to put a specific time frame in that. Next couple of months, next 3 months, next 4 months. But there's going to come a time where we're not going to be wearing fabric masks. We're going to be wearing surgical masks because they are so much more effective. And as we interact more with other people, that's going to be vital. Because as we interact more with other people, there's that, if the chance of being infected is constant, we interact more with other people, then our chances of being infected go up. If we add a surgical mask that does a better job of stopping the infection, hey, that really facilitates much of the opening up. There's no reason to wait for surgical masks. It's just something that we should monitor as we move along.
I should also point out that the countries which were prepared for this outbreak, Taiwan, Hong Kong, South Korea, very often had actually stockpiled surgical masks as part of their essential supplies. And Taiwan, for example, actually had an adequate supply to distribute them to the public at the time this epidemic occurred. So I think that that's something we should consider in the future, because this will not be the last epidemic of this type. And in reality, this epidemic alone may be with us for 2 to 3 years.
Related to this talk, can you both go over quickly just the healthcare and public safety elements that we need in place before reopening to tourists? I know you mentioned it a bit throughout your presentation, but just repeating those again for some of our audience.
Well, the first is a systematic system for testing, good contact tracing that can surge when needed, and the ability to isolate and monitor that isolation of people. I think that we've actually been relatively weak on the monitoring end recently. I think we've had reports of tourists not respecting the 14-day quarantine. I think that needs to be addressed directly, and we need to make sure that those things are in place. In terms of the overall healthcare system, I think prevention needs to get more focus and more attention. We need a much broader campaign for the public to explain to them that we are in this for the long haul, that basically they're going to have to socially distance for an extended period. Masks need to be part of that solution, and that we need to be prepared to go back into lockdown if necessary, should we start to lose control of this epidemic again. Lockdown has been proven effective. I mean, it has worked just about every place that it's been done now, and we've seen reductions in the epidemic. Where it hasn't been done well, many of the states in the United States, we're still seeing expanding epidemics. So I think we know what to do. It's just a matter of making sure we're capable of doing it when the time comes. In terms of hospital capacity, ours has not been challenged so far. I think one of the good things about the lockdown and the travel ban when it occurred is that it has kept us well within our hospital capacity. I mean, Lieutenant Governor Josh Green was just saying today that we've only used about 15% of the ventilators in the islands. So in fact, we're fairly good in terms of hospital capacity.
I think it's also, it's useful to remember when we talk about things like enforcement, and when we emphasize this in the written report, that heavy-handed enforcement can't be the norm by government. I mean, the one thing which absolutely has to happen if we're to get through this epidemic is that citizens need to maintain confidence in the government. And the government needs to take measures so that the citizens retain confidence in it. You know, and heavy-handed enforcement is sometimes necessary. There's sometimes where it's necessary to give somebody a $5,000 fine for violating a quarantine or for obviously taking action that goes against some of the stay-at-home measures. But on the flip side, you know, if 20% of the population don't wear masks, I mean, officers can give tickets all day and only hit a small percentage of those people. What's really critical is for people to understand why they need to do these measures. And what that really requires is a positive public relations campaign that educates people as to why are we doing these measures and why is it important for you in particular to take these measures. And most of the time it's important because you're helping other people. And this is a state where that type of theme goes over very well. Yeah, you're helping yourself, but you're really helping out other people not get the disease if you take certain measures. And I think if that type of campaign is put forth correctly, honestly, with correct information, it could be of great benefit here. We also talk in the paper about nudges. Sometimes just giving small behavioral nudges to people can really help influence their behavior, and that can be a lot better than people fining people. So for example, even like these little markers in grocery stores, that could be looked at as a nudge. You know, just all of a sudden you realize, oh, I'm not 6. Here's the marker that tells you I'm 6 feet away. That helps your behavior easily correspond to what might be an emerging social norm and something people might not pay attention to. They're busy, they're at the store, they have to get home quickly to mind their kids. And so small nudges like that can really, really be important.
Mm-hmm. What's the estimated economic impact on Hawaii's GDP and additional job loss from your proposed plan?
We have not calculated that. We haven't calculated that. The first stage of the plan, bringing back the non-tourism economy, is really vital. I mean, we've had the stay-at-home order has not just affected the tourism economy; it's also affected the non-tourism economy. And as we start to open up, the non-tourism economy is 77% of GDP. We can start to get much of that back. Now, there's certain parts of it that are going to be hard to bring back. It's going to be hard to bring back football with big audiences at Aloha Stadium this fall. I still hope that happens. I'm a football fan. Go Bows. I certainly hope it happens, but I don't see it happening. You know, as the academic in me, I don't see it happening. So there's going to be some activities that are mostly activities where locals exchange with other locals. I think we're liable to see less of that. But what's important is that we start to revive the non-tourism economy. The tourism economy, we again need a little bit of luck, and a little bit of luck is that testing becomes so available that leisure travelers are able to get a test before their flights to Hawaii. If that happens, we could well see the tourism economy reviving. And again, I'm optimistic in the long run. In the long run, too, a vaccine is going to bring back tourism. The best thing for Hawaii would be if a vaccine is developed in 12 months. That would be tremendously positive for us. But we face a tremendous period of uncertainty with the tourism industry. That's why I think it's so important for private firms in the tourism industry to get together and work on a private initiative to get testing available at mainland and foreign destinations that send Hawaii visitors. It's not that hard to do if tests become available.
I know you mentioned UH just a minute ago, and I think this is a student who wrote in this question. They're wondering if you could talk about the university opting for in-person classes next semester, and if the state will continue to take in international students.
Yeah, I had not heard the state that the university had opted for that. There's a lot of good reasons to try to get there, and the good reasons are I think it's hard to ask an out-of-state student to pay the amount of money that out-of-state students pay. It's a hefty sum. I can't see an out-of-state doing that for an all-online program. Graduate programs, there's many a graduate program, including the one in economics that I was associated with for so long. It'd be extremely hard to run that program online. Maybe a master's program, but certainly not a PhD program. So, it's really important to keep up the continuity. I think that with proper social distancing, with readjustment of instruction, that UH can do some in-person instruction. I'd be surprised to see large lecture sections meet, just because I think that's a type of activity that might be easily moved to online instruction. Perhaps then with smaller sections of students from the large lectures meeting. UH always has had the potential to try to space its classes out over a larger portion of the day. If it's able to do that, it'll be able to put some of the existing classes into larger rooms that will help enforce social distancing. I think it's a good move for UH to try to do this. But again, I hadn't heard that they'd actually decided this.
Mm-hmm. I have a few more questions. Once we're ready to open our shores, why not think of entry with a visa, shifting the responsibility from us to our visitors? And the suggestion was made that categories could be given to people that have recovered or tested positive within 7 days, etc. How feasible is that?
I think the problem with visas, at least for people coming from the mainland, is that the U.S. has been very clear that you cannot restrict interstate travel within the United States. Mm-hmm. I mean, we can impose the 14-day quarantine on those coming here because that's a public health measure. But I think even the governor himself in his conferences has said that basically they cannot just tell tourists or require tourists not to come. They don't have control over that. So I think there's a real challenge there. In terms of overseas travelers, certainly visa restrictions could include some sort of test associated with coronavirus. And I wouldn't be surprised to see that happen in the future.
Right. That question about UH, about foreign students coming to UH, I mean, I would assume that a foreign student, if they could get an antigen test, that the same procedure could be used as for tourists, that then we could waive the 14-day quarantine. It's even possible that UH would say, hey, just come 14 days early and we're going to put you through the quarantine in any case and then test you here. But I don't see any direct problems. I mean, it seems to me that problems with foreign students can be overcome.
So this one reads, tourism relies not just on us being ready, but that tourists have the disposable income to travel. Will our recovery, be delayed by the recovery of other states and countries? And when do you think people will even be ready to spend on leisure?
Well, that's a good question. Now, for instance, take Japan. Every time there's been some type of international crisis and Japanese tourism to Hawaii has declined, what we found is that it tends to rebound slowly. I think there's a certain cautiousness among Japanese tourists and families making sure that their incomes are in really good shape before they come here. But that's just been the norm. The Japanese tourism has revived relatively slowly. It's again, our other big market is California. It's hard to say what needs to happen. Now, remember, it doesn't have to be everyone who is ready to take a vacation. All that we need to find is people say, hey, I hear Hawaii is pretty safe. They have their epidemic under control. And I am one of the people who am still earning good money and I'll come to Hawaii. We'll see some of that. I mean, it doesn't have to be everybody. On the other hand, we may well just see that demand to come to Hawaii is depressed by people deciding that they're going to save a bit and recover from this economic crisis. It's also hit California too. Not nearly as severely as it's hit Hawaii. California doesn't have 37% unemployment, but California has its own problems, and it's the questioner is correct. It does rely upon. I mean, what happens in other economies is not under our control, and how people perceive just their willingness to take vacations. That's something that's unclear. But the cabin fever effect again may operate. Just people saying, I haven't traveled in a long time. And I always wanted to go to Hawaii, or that was one of my favorite destinations. I'm going to go now, particularly given this testing regime that's been set up.
Mm-hmm. I know you had mentioned you didn't calculate this, but maybe just an estimate. Assuming that no new industries come about or no vaccine in 6 months, what do you think Hawaii's overall economy is going to look like?
It's hard to know. It's hard to know. I think one of the things I said one of the things that we said in the PowerPoint was that we expect that the recovery will be somewhat slow and prolonged. And that's, I think that is where we stand today. If all of a sudden an effective treatment comes up, that's a bit of a game changer. It's really hard to predict what will happen then. If a vaccine is developed early, that's also a game changer. But as to when a testing regime could be put in place so we could restart tourism, that's a big if. It may or may not even be possible if testing remains very constrained, or the various groups need to coordinate can't get their act together. So yeah, I do think Hawaii is going to face some very difficult times over the next 6 months. On the other hand, there's a lot of federal aid that has been put in place to provide relief to workers who've been laid off. I know the aid for many families and people, the aid's been slow in coming, but at some point it's likely to come. And it's at least in many cases is somewhat generous. It would also not surprise me if the $1,000 payment to individuals, that there are additional payments made along those lines. Really hard to say what's going to happen. That's partly because national relief legislation certainly is not structured just to cater to Hawaii. It's set up to look at the whole national situation. So much of whether or not there's more relief coming from the feds depends upon what happens on the mainland, not just here.
What are the best ways to educate the public about why the lockdown is necessary? And what's your opinion about the recent protests to open the economy now?
Okay, first of all, I think we really need to do a public relations campaign with the public. I think we haven't really done much of that. I mean, we're not seeing professionally produced spots explaining the need for social distancing. We're seeing a lot of press conferences that most people never watch. We're basically catching a lot of information that's coming out in forums where they don't really reach the public. The public needs to be reached with relatively professionally prepared, simple messages that explain what's going on from a health perspective. And then I think they will generally make the right choices. I think people are afraid of this virus. They recognize the severe nature of this. And they need to understand that this is a long challenge that's going to be with us for a long period of time. That mask may become something that we all have to live with for the next year or so. And that we need to be ready possibly to go back home. And again, I think that hiring a professional marketing firm would probably be a major step in the right direction, basically to help to prepare these campaigns, because they know how to reach people, they know how to convince people. And frankly, I've been very disappointed in what I've seen coming out of WHO, CDC, and the others at the national and global level in terms of their public messaging campaigns, because I don't think they've been very effective at reaching people. And I think we do need to do a better job of that here. And not by doing press conferences, but basically by getting information out there in forms that people can understand and that is targeted toward them and what their actual needs are in terms of how they need to adapt, how they need to adjust their lives. And I think that's something that there are very good people for doing that. We just haven't recruited them yet.
Mm-hmm. A couple people in the audience have asked if they can, if it's possible to get a link for Alan Oshima's presentation.
Yes, I think I gave one in my slides.
Yeah, it's in the slides.
It's in the slides
Okay.
there. Are the slides being distributed, or we could put the slide back up if that was helpful?
We are recording this, so it will go up on Facebook, so everyone will be able to view it again and find that slide.
You know, if you go to the House Select, if you search for the House Select Committee on COVID-19, and you just click on the House of Representatives website for the committee, there's all the materials of that committee up there, and then Alan Oshima's presentation is there.
I have one last question. How do you reconcile today's report by Dr. Chris Murray, University of Washington, that says Hawaii is one of the 4 states that could open as early as May 4th?
I think Chris Murray doesn't know the situation here. And I think he's basically talking as a statistician and not as a public health person.
Mm-hmm.
And I want to say that we have to look at the situation on the ground here. Do we have the capacity basically to stop the virus cold should it start to surge again? We do not have that capacity today. And as such, I believe we are not ready to open. When we have that capacity in place, whether it's a month from now or 2 months from now, that's hard to predict, and it depends on basically what the state decides in terms of its reopening plan and what it puts in place in terms of public health measures. Then we'll be able to make an informed decision based on information here in Hawaii, not based on a statistical model that actually doesn't fit Hawaii particularly well.
Mm-hmm. Well, I think that ends our Q&A session. Thank you, Sumner and Tim, so much. This was really enlightening for me. I know we all appreciate you sharing your recommendations. And I think despite, how unclear everything is and how long this is probably going to take, you've reassured me that we can and will get through this. So there's hope in that, at least. Before we sign off, I want to give a special mahalo to Chief Justice Mark Rechtenwald for his support of the center and its mission. And I do want to remind that this recording will be posted on the King Kamehameha V Judiciary History Center's Facebook and YouTube pages for everyone to share and rewatch as many times as you'd like. And do you have anything to add, Tim and Sumner?
I just want to say that I really do believe that we have the talent, both the medical talent, the social sciences, and the people in government who are capable of leading us in the right direction here. Part of it is we really just need to make sure that we really keep at it. This is something where it needs really an intense application of resources. And I'm confident that if we keep at it, that we'll end up with a really good result here in Hawaii, even if we are stressed economically for a while.
Mm-hmm.
Thank you very much for inviting us.
Thank you. Thank you. And we can just close with aloha ahi ahi kako. Have a great night, evening, everyone. And malama pono.